to begin by explaining the problem our project tried to solve. In many parts of the Amazon, there are communities that still don't have access to safe drinking water. They usually collect the water from rivers or streams. Unfortunately, this water is often contaminated with bacteria, parasites, and even chemicals from nearby farms or factories. When we visited one of the communities for the first time, we noticed that children and elderly people were often sick. Some suffered from stomach infections, skin diseases, and dehydration. Family told us that they have to boil water every day, which took time and fuel. Others just drank the water untreated without knowing the risk. If they had access to a basic filtration system, many of these health issues could have been avoided, but they lack information and support. We realized that the water crisis was more than just a health problem. It also affected education, daily work, and even the quality of life. For instance, women and children often spend hours each day collecting water or caring about sick family members. Our team knew that if nothing was done, this situation would continue, so we decided to act. If we could help even one small village access clean water, it would make a real difference. Our main goal was to improve public health through clean water access, but we also wanted to raise awareness about how clean water is a basic human right. We chose to name the project Clean Water Access Initiative because we believe that every community, no matter how remote, deserves clean and safe water. If more projects like this one were implemented, we could prevent thousands of unnecessary illnesses. In the end, the problem we tried to solve wasn't just dirty water. It was the cycle of poverty and illness that unsafe water continues to create.
I will explain how our project helped solve the problem. After we identified the problem, we designed a water filtration system that was simple, low cost, and easy to maintain. It combined three key elements: a sand filter, activated carbon, and UV disinfection using solar power. These methods allowed the system to remove harmful bacteria, dirt, and chemicals from the water. First, we test different models in our university lab. Uh, then we adapted the final version to fit the conditions of the Amazon region, humid, remote, and without stable electricity. We hadn't adjusted the design. The system wouldn't have worked in that environment. Once the system was ready, we traveled to two communities with around 60 families in total. With the help of local volunteers, we installed the equipment next to the central meeting area of each village. But installation wasn't enough. We also trained the local families on how to operate the system and how to take care of the filters. We prepared simple instruction manuals in their native language and gave workshops about hygiene, water safety, and system maintenance. If we hadn't included this educational part, the system might have failed after a few weeks. We believe sustainability is just as important as technology. In the following weeks, we monitored the water quality and interviewed families about their experience. Many of them report that they felt safer, and some even shared stories of how their children stopped getting sick so often. If more projects like this one were supported by local governments, the access to clean water in rural areas could improve rapidly. In short, our project didn't just install a machine, it introduced a long term solution that empowered people to take care of their own health and environment.
Hello everyone, I'm Fabian, and I tell you who ran this project and how we organized it. The Clean Water Access Initiative was planned, managed, and executed by four of us. All the students are from the university. We came from different study programs as environmental science, engineering, public health, and education. What started as a university assignment for a community development course quickly grew up into real-life project. Once we identified the problems, we assigned roles based on strength. One of us led the technical sides, another focused on community engagement, and third handled logistics and funding. And also, I coordinated our time lab and communication. We also worked with external advisors, professors, and NGOs who guide us on sanitation practices and water purification. If they hadn't supported us, we might have made serious mistakes. One important aspect of our project was in conclusion. We didn't just arrive and install equipment. We spent time getting to know the people, held community meetings, and asked for input. We hadn't listened to the locals, and the projects would have failed or fell in poops. We also motivate local volunteers, especially young people, to be part of the process. They help with construction, water tasting, and distribution the training materials. If they hadn't helped, we wouldn't have finished on time. Our team also document everything, challenges, expenses, feedback, to create a report that we'll later share with our university or community partners. This report helps others see how small groups of students can lead meaningful change. This was not just a university project or school project, it was a team effort between students, professionals, and the local community, and if more young people ran similar initiatives, we could accelerate process in many areas of social and environmental development.
Okay, now I will explain what we needed to make this project happen. First, we need a clear vision. So we started by doing research about some water filtration technologies that work remote and tropical environments. And also we read some articles of the National Geographic. We studied cost and we compared materials. Okay. Now the second one was funding. So we launched a crowdfunding campaign online and we organized some events at the university, like cultural fairs or some beneficial concerts. If we hadn't raised the money that we needed, the project would have stayed just as an idea, right? The third one was partnered. So we contact local non-profits that already worked in the Amazon. So they help us with transport, with logistics, and also to contact leaders of the communities. And the third one is the materials. So we ordered some filters, some tanks, solar UV devices, and some water testing kits. So we chose equipment that was both effective and easy to maintain. If we had bought some complicated devices, the community wouldn't have been able to take care of that. Right, to continue, the transport. That was another challenge because the village were insulated and we had to move all by boat. So we planned and we kept in close contact with some local volunteers that they helped us to receive the material when we arrived. And finally, we needed commitment. So this project took months of preparation, long nights, and sometimes some doubt. Some people told us that it was too challenging for students, university students. So we believed that if we worked hard, we could make this happen. And we did. We learned that even without a big organization or years of preparation, if you are motivated, you can bring a change. Yeah, thank you.